Hi, you have good afternoon. How are you all feeling? Now, I'm here again, and my name is Jill Helen Onigbede, the owner of Terrific Beauty Fashionista. And here we are at Premier Health Spa, right in Houston, Texas, where you can get your beautification done, anything you want, health-wise. We are here on close to First Colony Mall, Highway 6, Sugarland, Texas. Okay, so this is the beautiful place that belongs to Miss Cathy Bentley. You can get all your beautification done here. You can have your microdermabrasion, micro needling. You can get your vitamins. You can consult for weight loss, Botox, fillers, name it. If you want to use their beauty products, she is gonna assess you and bring you 100% results. So stay tuned and watch out for the video.
Welcome to Premier Health Spa. Thank you.
Nice to see you.
Finally.
This is a beautiful place.
Thank you. Wow. Well, this is a reception, as you know. We take clients here.
These are your products.
Yes. That's skincare product. And then the one in the middle, some vitamins.
Some vitamins. Okay.
Please.
All right, I will call back.
And
Thank you.
here, here is our assessment room. We draw blood here for people who want to do hair restoration. We draw blood, or people who are just coming in for annual physical check. We do the blood work. For the hair restoration, we draw the blood, use a centrifuge, spin it for 20 minutes, separate the plasma, the platelet, and then inject it to wherever they want it, either the hair or the face.
Oh wow, so that's how it's done?
It's regenerative medicine, yes.
Oh wow,
Yes.
okay.
And that's what we do here. This here is our facial room. All sort of facial we do in this room.
Okay.
Hydrofacial, microdermabrasion, signature facial, microneedling, all sort of facial is done in this room.
So microdermabrasion.
That little machine over there is for microdermabrasion.
Okay, so that lasts like how long for you to do?
3 months.
Oh, every 3 months.
Every
it's
3
needed
months,
every 3 months.
come and do your, yeah.
And how long for the
Upstairs for you
session
to
needed?
sleep. 30 minutes.
Okay.
Yes.
Okay.
Yeah. And come on, please. Next room here is our body sculpting room.
Okay.
So we have different kind of body sculpting machines, depending on what the client is looking for.
Okay.
That one helps with contrast the muscle.
So for this,
For
once the stomach
yeah,
to
could be
go down.
your stomach, your thigh, your love handle, the back, wherever. So that helps with contraction. This sucks out the fat.
Oh.
So it's like suction. Cryptolysis, yeah.
And we're gonna see the fat.
Yeah, you don't see it.
Okay, okay.
But that helps with that.
Okay.
And this is like mesotherapy, like heat, applies heat
Okay.
direct to the surface of the wherever the fat is.
Okay.
So that's what we do in this room. Like it's like mesotherapy, kind of fat burning room to help you with body contouring.
Okay.
Contouring.
And that body contouring lasts you for a lifetime.
As long as you are able to keep it. If you
Okay.
gain weight again, you come back.
coming back.
And this is my, of course, my injecting room. This is where I do my injectables. I love my
I see the
injectables.
injection.
Yes. Yes. So I do my injectables here. The Botox, the fillers, pedio thread. Do you know about pedio thread?
Which one is the pedio
Pedio thread is like a mini facelift. We use thread and needle.
So it's gonna be like the threading we do for a eyebrow?
No. This is real thread with needle. It looks like that.
Is it painful?
Well, we know you.
Oh wow. And it's
No pain, no
lipstick.
gain. It's beauty. So that's video thread. It's thread and needle. So it makes you, it's pretty much takes some years of your age. If you do have the double chin
The
here,
double chin, I think
you
I'm
can
coming down with
actually
one.
do that and put it up. The needle is long. I don't have it already. It's locked up. So it's long. We inject from here, push it all the way down to wherever we want it.
Okay.
Leave the thread in there and pull out the needle. So the thread actually pulls you up. So for the people with double chin, you can actually gain, reduce the fat a little bit by lifting you up like that.
Wow. So you're gonna leave the thread in there?
Yeah, the thread is the one that helps pull the skin together. So it's like using it to lift, pulling it up.
Oh wow.
Yeah.
So and that one is a one-time thing?
No, it's good for 2.5 years.
Then you come back.
You come back. Then we have the fillers too. The cheek filler, the chin filler, the jaw filler,
Just to
nasolabial
keep your
folds.
sides.
Younger.
Yeah, younger.
So as we
Firm.
get older, we lose some fat pads on our face. The pads, So when we're younger, we have the triangle face like that.
Okay.
Okay, as we get older, it flips the opposite. Now we're here like this. So we're dropping all the fat
Fat
here.
here.
So in order to replace the fat, you have to deposit the filler in those areas.
So we're losing elasticity.
Exactly. So when you deposit it in those areas, you firm up a little bit and it lifts. For example, if you deposit filler in the cheek area, which we call the contour, it helps you lift up.
Oh, wow. So do I need one? Do I look like I need one?
I have to assess you. I don't want to say that.
I think I'm coming back, so we need to see, because all this, especially the OPDO,
Video
is
thread.
new to me. I've never
Video
heard
thread.
of that.
It's been around for a while.
Oh.
That's what they call mini facelift without surgery.
Oh, okay,
So-
okay.
It's facelift without surgery.
So, but
No
that
downtime.
one, if you do the
Video thread.
PDO thread, you can still go out around, or you have to go.
No downtime. Yes, just like those machines, no downtime, and then you get your body.
So like, how long will the PDO thread be while I sit there? Like how many minutes? Or
It's about 45 minutes procedure because we have to numb you.
okay.
Yes, and we have to make sure we clean you. Make sure
Yeah.
there's no chance for infection. Yeah.
So there might be some needle
Yeah.
bleeding.
Because we have vector areas where we go in from, make sure those is well sutured and no chances for any infection.
Alright, so anybody on blood thinning medication
Oh,
has
we
to let
have to
you
send them
know.
all that information before coming prior to. Yeah.
So
Even the simple procedure like Botox and fillers, if you are on blood thinner, that, we'll do it, but there's tendency for you to bleed.
bleed.
But that's just a minor
thing.
It's those tiny needles.
Yeah. And also you are in the field, you can stop the bleeding while they're here without it becoming.
That's why you have to go to a professional.
Yeah. And
Not go to people under the table.
Under the
to do
table,
your
it's
fillers
cheap.
and it's cheap, but what you're gonna get at the end of the day, you can get
And you
deformity.
don't even know what they're gonna inject in there.
That's
Because
why-
that's what we see on TV these days.
Yeah. Everything you use gotta be FDA approved, but make sure you go to a provider who knows what they're doing, who is trained for that procedure.
So do you train people here? No, you don't do
I
training.
can't, no, not
There's
yet.
no time for training.
Not yet. Maybe someday, but now no.
So when are your busiest time?
Weekends from Friday. Friday, Saturday, we're very, very, very busy. So this is Botox.
Okay.
Sorry.
Yes.
Okay, so this is Botox. It helps with wrinkles. It relaxes the muscles. The muscle relaxant is neurotoxic. So my client gets it like every 3 to 4 months. It helps relax the muscles because she's constant and she takes care of herself all the time. She's one of my best clients. So right now we're just gonna top up. I think she was there about 2 months ago.
No,
So
it was
it's 3 months already. Okay, so she's due, and so we're gonna top up today. The marks I made is where I'm going to actually put the medicine. Neurotoxin is actually medication. So we're gonna put it in, and again, that's my very good kind. Yeah.
So like it reduces the wrinkle.
Reduces the wrinkle, makes you look younger. There's a lot of misconception about Botox. People say, oh, I'm too young to get it. No, actually I have 25-year-old getting it here. Because once they start early like that, it helps them age gracefully. Okay. And they like age backward.
Oh, wow.
So
it's not necessarily for old people?
No, that's a wrong conception. No, it's not.
Okay, so can African Americans get Botox too?
I want to say like 60%, no, let me put it this way, maybe 45% of my clients are African American.
Yeah. That get the Botox?
Yes. It's for everybody, not, she's...
So no side effects?
No, there's no side effects. It's muscle relaxant. The worst that can happen from this medicine is if you put it in the wrong place, it gives you like droopiness, and that lasts for 3 months. But after 3 months, everything comes back to normal. But yeah, that's why you have to choose your injector and go to the right person who knows what they're doing.
Okay. So they have areas to go. Yeah.
Yeah, I mean, I'm licensed. I know what I'm doing. I know where to inject the medicine. For example, if I go put the medicine somewhere around here, she will end up, if I put it somewhere around here, she will just end up drooping like that for 3 months. And it's going to stay like that for 3 months.
Oh, wow.
Yes.
Oh, wow. So you viewers... You
have to know your anatomy. If you know your anatomy...
You need to go to a licensed person for you to be treated right.
That's
and
correct.
Without you getting side effects that will last 3 months.
Yeah, you don't want to do this over the counter or under the table. No, this is not something you want to do under the table. They do have a lot of fake people out there buying fake products, from Google. That is not for FDA recommendation. So they do buy it for cheaper. It's probably coming from outside the country, and when they have those side effects, they don't know what to do because they got a fake one. So you need to go to a provider who is registered with this company. For example, this is Allergan. Botox is from Allergan, so I'm registered with Allergan, and my products are from them, and I can trace it. There is a lot number, manufacturer, label, and expiration dates that we have to register, put in the charts.
So like now that you're giving it to her, you have like a log whether you're gonna be like, okay, I administered these to so
That's correct. As a nurse, I have to chart every medication I give, and being a nurse practitioner too. Now I don't want to joke with my license. So everything I give here, I have to chart it.
Okay. What is not charted is not done.
Yeah, it's not charted, it's not done. So she can come back tomorrow and we'll pull a chart out, and I say, oh, when you came yesterday, you got X amount of units in this area, and that's how to do it. You do it, always do the right thing. So I'm going to go ahead and inject her now.
Okay.
So this is the DOA muscles. We're doing that just to relax that muscle up there. As we get old, we have that muscle that pulls down, but this will flip it actually. Flip it the opposite. That's the effect of this. I'm going to go to that side to inject the other. I'm going to be switching back and forth because I'm going back again.
So I'm getting my exercises.
There you go. That's done. I have a 5 there. Smooth.
She's used to doing it, so she's so relaxed and comfortable.
Yes, so we got this 25 and this 25 I'm going to spread up here. Okay. So, you ready? Gonna go down there. Our Proceros is not really strong right now, so again, like I said, she's used to getting this, so it's like more of touch-up that we give you right now. And you see she's not complaining.
But do you have to numb it first?
No, we don't numb Botox. Now if you're coming here for fillers, we will numb that. But for Botox, no, we don't numb. And the clients already know that they're not going to be numbed. And this area is for lifting our eyebrows. Yes, she's doing wonderfully well. Voila. One more to go.
I had a total wrong impression of Botox. I always felt like it's old people that have wrinkles.
Wrong. Okay. Now I'm gonna do her body lines. Now this can be paid for.
So if you have to compare the pain that comes with administering Botox, can you compare it to you going to get a wax?
Oh no, I'm sorry for my language. No, that one hurts. No, Botox is not. It's just a 2 minutes procedure. You're in and out fast. That wax hurts. Yeah. And a lot of people are used to this, so they don't feel the pain.
So is it just like getting
This is called
acupuncture?
I've never got that. Acupuncture?
Yeah, pretty much.
Oh, is it?
Pretty much,
Okay.
because acupuncture can be so relaxing and you don't enjoy it after.
Okay, so she can tell you that since she probably has gotten that done in the past. Okay. Now this is crossfit by the eye for all those lines that we have around there. So at the end of the day, it's going to make, you want to see? What's going to happen here is those lines are going to be relaxed and smooth like that. You know, they're like this now, but they're going to be relaxed and smooth in about 5 to 7 days.
Oh wow.
We're going to do the other side.
That's fast. The result is fast.
Yeah.
For me, it shows after 2-3 days. Yes.
And for her, like she said, she started getting results in about 2-3 days. I make those marks there. That's my landmark. Just for me to know where I'm injecting.
Like you're going for surgery and
Right.
making a surgical site.
Correct.
Already.
So we are done. And she took it real nice and
Yeah.
easy.
I thought she was gonna be screaming.
Nah. And now I'm going to clean her face.
So you okay?
Yeah. It's like a little,
So I'm going to
shot
clean
in the
her.
doctor's office.
You want to see? I mean, it's up to you. So I'm going to clean the marks that I made. And there is a post-procedure instruction to neurotoxin. She cannot go to gym today. She knows that already. She can resume her gym activities tomorrow. She cannot do facial for the next 2 weeks. She knows that. She cannot rub. Okay, so we pat, but you don't rub. Don't move the medicine from where, with the corset is. And she can't lay down for the next 4 hours.
Nobody what I do that.
She can lay down
She
here.
cannot lay down.
She cannot lay down for the next 4 hours?
Yes, she can't sleep that minute of that. She was going to say something that normally,
Normally, if I have any schedule, I cancel it next 4 hours and then just, sit up.
Oh, yeah. Okay. So you going on straight now?
yeah, she knows what to do, what
Yeah.
not to do.
And I try to avoid eating garlic or, there are certain food makes more bruises.
Oh, okay.
Yeah, but having bruises are very common, so don't be surprised when you have bruises.
And that's why we have this Anike. Would you
Yeah.
like me to apply some Anike?
Yeah, okay.
You good? Okay, so Anike help with bruises. So if you apply it to the people who need it, within 30 minutes, the bruises goes down.
Oh,
But it is
Yeah.
not big bruises, just
Oh,
small.
it's just tiny. You can barely
Yeah.
see them though.
Yeah.
And there are some factors that can actually disturb the effect of neurotoxin. Like if people take medication like depression, anxiety medication, people that fly a lot, so that helps them metabolize this faster.
Wow, okay. Wow. So you're not gonna come back now until 3 months time?
Yeah, it lasts longer whenever you do more regularly. Yeah, that's what I've noticed. Yeah, the very first time I got 100 units.
Wow. So how many units did you get this time?
60.
60. So
Yeah.
it's like it keeps reducing because
Yes, because she's on top of it.
After that 100 units, when I came to her, that was like 40 units and it lasted pretty much. And then this is the time I do more, so it will last longer. And the next time a little bit less and more and less.
Oh, that's good. I'm learning something today.
That's correct.
Thank you very much for giving us a chance to work with you.
The next client's probably is here or will be here soon. So this is
You are busy.
yes. I mean, nobody wants to age these days. this. We have to do what we need to do to keep looking. Do I look like I'm almost 55?
No, you're not.
Okay, so you have to do what you need to do to keep looking younger.
Okay, so I guess I'm coming for chemical peel.
Oh, well, sorry. The season is over for chemical peels. You can only do that in the winter.
Oh, so it's not in the summer.
You can do the smooth peels, which we have now, but the one that you're probably talking about is the one with the TCA. It's very strong. You can only do that during the winter. We have sun now.
It's not burn the face.
Yeah, it's not advisable.
Alright. Thank you very much for having us.
Thank you, my darling.
Thank you. The one that I know very well that I'm interested in.
Yes, people do this.
Yeah.
So here is the place for IV hydration, vitamins, for people who would probably drunk last night and want to clean their body for detoxification, so they can come and get Angoba drips. We have energy drip, beauty drip, endurance drips, Maya's cocktail, anti-age drips. So all kind of drips. Whatever, even with customized drips to your need. So whatever kind of drip you want, you customize it. Just tell us your symptoms.
So the Angola one actually got me. So somebody went to the club like Friday night and feel like they drank too much. They can just come in here and get detox.
That's correct. And let's say you went to club on Friday night and you have a interview on Saturday morning and you want to be clean, just come to me before your interview.
Okay.
And we're going to get you clean and detox.
Okay. You hear that, Nigerians, my African Americans, my African brothers and sisters. You've been to the club on Friday, you have a job interview, your wedding is tomorrow, and you want to be clean without you disgracing your in-laws. Premier Health Spa is ready for
That's
you.
correct. And then we have coffee here for you too. So hey, while you get your drinks, if you want coffee, hey.
And you get in the drip.
I mean,
So the anti-aging, all these drips that they get in, there's no side effect. They're just like you taking your supplements.
Exactly. The vitamins, remember, if even if you have too much of it, your body excretes it. So there's no side effect. No.
So
Your
what
body
about
gets rid
the
of it.
suctioning part for the tummy?
Yes. Again, that is non-invasive. All my procedures here are non-invasive. Well, I mean, majority of them. The video trend is invasive because I have to
go in there.
Yeah, but for the tummy thing, it's non-invasive. Yeah.
Thank you very much.
You are very welcome.
Yeah, so what, that's a sauna?
Yes, that's a sauna for some people who want to lose weight or just want to get toned. Some people come here, get into the sauna and eventually get the drips. And after the sauna, but that's a sauna right there. And
so
that's the way to the bathroom.
fully equipped.
Yes.
You are fully
And if you want to
equipped.
sit down and drink champagne, you can sit there drinking champagne.
So you serve them champagne too?
Yes.
That's nice. So what is it?
Oh, here, this is a skin analysis. Skin analysis machine. It helps you analyze your face. You put your face in here, analyzes your skin for you, your texture. I think it has 10 different functions. It tells you about sun sensitivity, hyperpigmentation, and several things like that. Yeah, tells you about your skin age and and then it gives you options on what you need to do.
Oh wow!
Yes.
So do you do assessments on men as well, or just women?
Yeah, men and women.
Well, men and women.
I mean, I have a lot of male clients, so this place is not only for women, men and women.
Wow.
Yeah. If you come, I mean, you probably came when there's no man here, but some of the times I have men here.
Okay, thank you very much, Miss Cassidy. Please,
Thank you. Thank you so much for coming. I appreciate you.
My people, we have come to Premier Health Spa today to show you the benefits you can get in getting your beautification done. You can detox here. If you want to lose weight, you can get assessed here. They don't just prescribe medication for you to go lose weight. They don't just say, okay, you're gonna have Botox, you're gonna have fillers. This is a professional with loads of certification. I came in and I was like, wow. She has it hanging on the wall, which is telling you that you are at the right place. Please come to Premier Health Spa. She's in Sugarland, a very good location. Lots of parking and you will be comfortable. The atmosphere is beautiful and it's serene.
That's correct. Now that you mentioned weight
loss.
loss, yes, that's a big thing for us now. We offer Manjaro and semaglutide. It's a shot that you give yourself once a week in the tummy, and I've had a lot of success. I have a lot of clients who are very happy with the result. We put them on a 3-month program.
Okay.
So after 3 months, you should be happy with your results.
So they're gonna be injecting themselves.
We have some who don't want to do it, so we make them come in here once a week and we give them the shot. It's a very tiny, it's like mosquito bite.
Is it like a insulin pen?
Yeah, we
like
use
a
insulin
quick
pen.
Okay.
We use insulin syringes to deliver the medicine, but the medicine is not insulin. We use Manjaro or Ozempic, which is semaglutide or tirzepatide. So we use both medicine.
Because I see that a lot of people are leaning towards semaglutide now.
Yes,
and
that's the
Ozempic.
popular one. So, but some people, semaglutide don't work for them, and so we switch them to the Manjaro, which is the tirzepatide. It's more expensive, scarce, but I get it. I have my company pharmacy that I work with.
Oh, okay.
Yeah, and I have a lot of clients who are very happy with their result.
With the result?
Yeah.
Oh, wow.
But I make sure I put them on the 3-month program.
Okay.
Because
so
you
they
can't
don't
just do this for
it.
1 month and
Okay.
then give up and you expect to lose weight.
Like people that say, oh, I have to go on a boat cruise next month, I want to lose 40 pounds, and they're rushing to you, you don't want them to put you in
No, I have to go according to the FDA, the protocol. There's a protocol for this. The first month we go slowly, then we titrate higher the second month, and the third month we double the second month. So
Okay,
the
like-
first month is slow. Second month you double the first month. Third month you double the second month.
So like you're checking out for their tolerance.
Correct. But that's the way they want us to administer the medicine. We have to follow the protocol.
That is good. I'm
Yeah.
so glad.
I do also hormone replacement therapy. Let's not forget that. For women of my age who are probably going through premenopausal or postmenopausal, and they have all the symptoms of fatigue, lack of sexual desires, lack of sleep, mood swings, and all that. You don't
Hot
have to live
flashes.
with that. Hot flashes. We really do not have to live without. There are medications for that. So
Okay.
we can take care of that. I do the pellet for women. I insert the pellet into the glove. One of my videos probably will show it. It's a small procedure, office procedure that we do for like 5 minutes procedure. And I put the medicine, testosterone, estrogen in the glove muscle.
Oh,
And
wow.
then it stays there for like 3 to 4 months, but they get the benefits,
And enjoy their life.
and enjoy their life. You don't have to live with those things. There are medicine for these things. Don't say it's that's where it's gonna be, but no. Life goes on.
I know, because now everything is about beauty.
Yeah, beauty,
and
but
fashion.
I don't have to say because I'm old and I'm going through menopause, so life has to stop for me. No, I'm enjoying my life like an 18-year-old. So
Okay, let's go there. That's cool. Thank you very much.
you're very
for
welcome,
giving us
very,
your
very,
time.
very welcome. So
And you have
I have a
a
lot of other services that I can't even think about right now,
I
but my
know.
website will show you.
Okay, thank you very much.
Thank you again for coming.
Yeah, thank you.
Enjoy the rest of your weekend.
Thank you, ma'am. It's Helen.
Helen, hi.
I'm good. So the vitamin B12, what are you getting it for? Is it for
Energy.
Energy. So are you anemic or
I'm borderline.
borderline? Oh, okay. Okay, because I'm a borderline anemic as well.
Yeah.
So I was thinking maybe it's also for beauty or just the energy.
I have it with lipo also,
Oh, okay.
but it mostly for energy.
Oh,
I
wow.
figured I'll just add lipo to it, might
So
as
how
well.
often do you get that?
Every 2 weeks.
Oh, that's great.
Yeah.
So you're always on the move. You're energized.
I'm a teacher.
Oh, okay.
I need my
Thank you for your
energy.
service. Anyway,
Yeah,
you guys
thank
are on break right now.
I am.
Thank you for all you do. So
Thank
nice to
you.
meet you. Thank you for the opportunity.
Thank you. So one of my coworkers actually sort of mentioned to me that I seem to have more energy
So you've been getting it?
since I've been getting it. So
Oh, that's good.
Yeah.
That's good.
Yeah.
And it's just vitamins, so why not just take it? Since it has no side effect.
Exactly.
That's
Exactly.
nice.
And I also did Botox here.
Oh, you do your Botox here?
Yeah.
Oh, wow. So when are you due for the next one?
I need one. I need it. I need it for the forehead.
Okay, great.
Oh, wow.
But your skin looks good.
Thank you.
So do you use our skin products as well?
No.
No, okay, because she said she has skin products as well. That's nice. It's so nice meeting you,
Nice
ma'am.
meeting you.
All right, thank you for the opportunity.
Welcome. Thank you.